To me, the most important part of what we've achieved at the Dubin Breast Center is we have this incredibly serene, physically beautiful environment for patients to receive their care, but we are also doing the most cutting edge, interesting, exciting research for patients. We are very much a part of moving the needle forward and making that progress happen for our patients with breast cancer.
In one word, the Dubin Breast Center is home.
The Dubin Breast Center is like family.
The Dubin Breast Center is solace.
I was diagnosed with breast cancer, and on the same day found out I was pregnant, 3 weeks pregnant. The Dubin Breast Center gave me hope. They gave me hope that someday there will be a happy day where I am holding my child in my arms, and saw me through to that miracle.
What we're trying to do is develop a bigger armamentarium to treat our patients so that if they get through option 1 and that doesn't work, we still have option 2, 3, and 4. And this gives our patients the highest likelihood of surviving and thriving this disease.
Research means hope. It means courage. It means that we can look forward to the future, and that means everything.
My own personal experience that kind of lit the fire in my belly about breast cancer research was the fact that my mother was diagnosed with breast cancer when I was in medical school. We're trying different approaches to really hone in on what's driving an individual patient's breast cancer. The tumor bank here is a collection of patient breast tumors that have been collected during the course of standard treatments. Understanding the individual genetic makeup of patient tumors is absolutely essential for us to be able to develop personalized therapies for our patients in the future.
Some of the simplest questions we're asking are, how does this cancer grow? Is there a good way to stop it? Can we use treatments that kill the tumor cells specifically but don't affect normal cells?
Our goal here at Dubin is to have clinical trials of new drug combinations for each subtype of breast cancer. One clinical trial that I'm involved in right now is looking at a new combination for patients with triple-negative breast cancer, which is inherently a more aggressive type of breast cancer, but it's also a more difficult cancer to treat.
I was diagnosed with stage 2 triple-negative breast cancer 5 days before my 38th birthday. A new study came out that showed a different type of chemotherapy treatment for triple-negative breast cancer, and I was the recipient of some of the new research and the new treatment options. If Dubin didn't value research and didn't take part in a lot of the research studies that were out there, I mean, I don't know where I would have been. It saved my life and made me a survivor.
I walked in and I was thinking, wow, this kind of looks like a spa. I just felt like I was loved and supported here.
There was such an incredible human touch to this place.
At the Dubin Center, we're committed to one thing: improving the lives of women with breast cancer. With the early diagnosis and improvements in therapy, we're increasingly making women live longer and live out their natural lives, and that's a victory.
How fortunate we are to have a center like this.
The gift of life been given back to you. Anyone who has breast cancer needs to come here. They will have all their needs taken care of, both emotionally, physically, mentally.
What distinguishes the Dubin Center is our unique vision of a patient-centered environment and patient-centered care. For us, it's all about the patient. We've been open 4 years. We have a lot to be proud of. It's astounding what we've accomplished. Until every single woman has been cared for and cured, we have a long way to go, and we have a lot to do, and we're doing it.
They were my army. They fought with me to get there. And now, you know, his happy soul is here. His smile shines through. How do you say thank you? There are no words. There are no words. Thank you.
Places like this are instrumental in finding a cure.